All right, so next part. So we left off with um, the all of the things that happened leading up to my diagnosis. So now I am at the Texas Health Hospital in Frisco, and after the diagnosis, I had got blood work done before, and I would have to get transferred to Texas Health in Plano, which specialized in oncology or cancer patients. But before I would get transferred over, I had to get a blood transfusion. Now, I've never gotten a blood transfusion before. Obviously, I'd given blood before, but I've never gotten blood. But because my blood levels were so low, I had to get a blood transfusion. Now, getting the actual blood wasn't, it wasn't too worrisome. I didn't feel anything about it physically. I think it was more of a emotional uh, heartache than anything else. Uh, Before I got the blood, they had to do a bunch of tests to make sure that the blood that I was going to get was compatible. But with anything like that, you always have side effects. The only side effect that I can recall having was occasional muscle spasms, but nothing too major. Uh, I got the blood transfusion, and that following day, I would be transferred to Texas Health in Plano. And like I said, the physically it wasn't nothing to it. I think it was just the emotional drama of knowing that you have a stranger's blood in your body, but that makes me it, it 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 started a roller coaster of emotions for how important it is to give blood because over the next I want to say probably 2 or 3 months I will be getting maybe one, two, sometimes three blood transfusions per week. And each blood transfusion, I would get about 450 milliliters of blood. Now, to put that in perspective, 450 milliliters is like filling up a can of Coke. So I would get two, three of those per week on a regular basis for about the next 2 to 3 months. So if that's something that you feel, make sure that you go and you give blood because it actually does save lives. And I wasn't aware of this before, but uh, the blood that they give, obviously they store it and they keep it safe and all of that good stuff, but it actually expires. So you give blood, and if it doesn't get used within a certain amount of time, it just gets discarded, and now it becomes kind of like a revolving door of people giving blood. And without people giving blood, people such as myself would basically wither away, I guess. So I'm getting transferred. At this point, uh, I knew that I was gonna have to rely on my faith a lot, and I was blessed that my grandmother had taken me to church and had always you know read the Bible to me and preached with me and prayed with me before she passed in 2013. But I knew that I was gonna have to lean on my faith a lot. So going through the process, I told myself that I am going to depend on God to make the decisions. I wasn't going to act as if I knew more than the doctors or I knew more than the nurses. I was going to take their advice and lean on them 100%. And every night when I woke up, I prayed. Every morning when I woke up, I prayed. Every night when I went to sleep, I prayed. I read my Bible throughout the day, and uh, I don't recall at all praying for myself. I prayed that my family is able to handle this. My friends and my people who are close to me were able to get through this. Also prayed a lot to give the doctors and the nurses the strength and the knowledge and the ability to make the best decisions possible. Just not but for me, but for everyone who was on that cancer floor with me. Because over that time, I would see a lot of people come and go, and it ranged from little kids all the way up to senior citizens. So it was very eye-opening experience for how this disease affects everyone, not just older adults. So that was where my mind was at once I had to go to the oncology at Texas Plano. So my diagnosis was AML, which was acute myeloid leukemia. I also got diagnosed with pancytopenia, which is severe low count for all three blood traits, which was my white blood cells, my red blood cells, and my platelets. And obviously, I told you before I had the migraines. Now, for those who don't know, the AML is basically cancer in your bone marrow. So that's why they had to do the bone marrow biopsy for me. And like I said, like most of the stuff that happened, going through the procedures was not painful. It was the side effects after the procedures that was painful. So the bone marrow biopsy I got, and it was fine. But a couple days later, I would start feeling a lot of pain in my hips and my knees, and a lot of my joints, or my lower extremity joints. The cause of the AML is unknown. Some people believe that it could be genetics, but I hadn't known anyone in my family who had leukemia. Wasn't close to my father, but he had passed about a year and a half earlier, and wasn't sure what he had passed away of. But I never asked, because I didn't want those type of things to be in my mind as far as what a parent had or what a relative had, because then I'll be living my life thinking about can't do this, can't do that, whatever, whatnot. So my thing was I want to stay positive, and I want to think positive thoughts. So my thing was to allow the doctors to do, or the doctors and the nurses to do what they do, and I was able to control what I was able to control. They told me that it would be wise for me to make sure that I keep eating, because I would start getting nausea. I would start getting, feeling sick from eating. They told me they wanted me to stay active, try and move around as much as possible. So everything that they suggested that I do, I did it as much as I could for as long as I could until I wasn't able to anymore. So that Monday, like I got diagnosed on a Sunday, that Monday I got transferred, and that's when I met all of the doctors that I would be seeing. My oncology doctor, infectious disease doctor. I don't know what they call it. I think they were called like a hospitality doctor or something, where they come in each day just to see how my mental state was. I would see a dietitian. I had a bunch of nurses. I had a lot of technicians that would come in. And that Monday, it was just visiting a lot of different people, and they would tell me, what the procedures were going to be over the next week and the next 2 months. So after talking to all of those individuals, I had to start preparing my body to start receiving chemotherapy, which I would start receiving on that Tuesday, October the 29th. So it was diagnosis, and then 2 days later, I would start getting chemo. But before I started getting chemo, there were some procedures that had to happen. I had to start taking antibiotics, antibacterial, and antifungal medicine. And at the time, I just had an IV in my right arm. So when you get chemotherapy, it'll be better to get a PICC line. And what a PICC line was is just like a catheter that fed from underneath my left arm that went into the veins near my heart. And it was a dual PICC line, so I was able to get both my chemotherapy and also the other drugs that I needed during that phase. Now, the chemotherapy that I would get was called a 7-3. 7-3 meaning one chemotherapy drug I would be taking for 24 hours a day for 7 days. The other chemo drug I would be taking every 8 hours for 3 days. And when I wasn't taking that chemo drug during the 8-hour period, in between that, I'll be getting my antibiotics, antifungal, and antibacterial medication through my IV. In addition to all of the pills that I would have to take orally as well. So it was a lot of medication, and I was constantly being fed medications and chemotherapy through my IVs or through the catheter, and I would have to take some pills probably I would say every 2 to 4 hours, and I would do that over the next 2 months. Now, one of these side effects of the chemo and sometimes from the blood transfusion is high temps. So every night, I mean, it was like clockwork. Every night, say probably like after 8 o'clock or so, after I ate dinner, my temperature would spike to over 100 degrees. So the doctors and the nurses would do whatever they needed to do to try and bring my temperature down, which meant I was basically not getting a lot of sleep because getting the chemo drug and taking the other medications, and they were taking my vitals, I was being basically poked and prodded, I say, every 3 to 4 hours, either by the technicians or by the nurses. So it was hard to get sleep especially during that first week. It got a little bit better as the days and the weeks went on, but that first week was very tough because you're dealing with a lot emotionally and physically, and then you're not getting sleep on top of that. And me being the person I am, I'm trying to be as active as possible. I'm walking around in my room. I'm walking around the hospital floor. I mean, at one point, I was in the hallways doing squats and arm circles and lunges and whatever I can to keep my body as active and as fit as possible until I would say maybe the 3rd or 4th day of the chemo. My body was so tired and so fatigued, just turning over in my bed became a chore. So even with that, I would still walk around my room, just from one side of the room to the other. And, I would I had a couch in the room. I would sit on the couch and stand up, sit on the couch and stand up, doing whatever I can to be as active as possible. Also, because you're taking the chemo, what the chemo does is it basically kills every cell in your body. So my blood count would continue to go down, and like I told you before, I was getting blood transfusions to replenish the blood that the chemotherapy was killing. So I would get blood transfusions, and because of the chemo, I started getting lesions and sores on my feet, on my arms, and on my back, to the point where it became difficult to walk. It became difficult to lay down on my back. And I mean, if you've ever been in a hospital bed, you're not laying, like the only way that you can lay is, on your back. So that became difficult. One of the things that I did when I was in the room was I tried to make the room as comfortable as possible. So, I had my wife bring a lot of, my clothes so that, I can actually get up in the morning and put on some clothes that I would wear normally. I didn't want to walk around every day in a hospital gown. She bought some of my covers. She bought some of my pillows, which, I mean, the pillows were a lifesaver because I don't know if you ever use hospital pillows, but it's like non-existent. Like you lay on those things for about 2 minutes and the feathers are gone. So just having pillows so that it can make it a little bit more comfortable on my body and on my joints really helped. And the lesions on my feet, it made it hard to walk, so I had the wife bring me some house shoes, because the only time I would even put on shoes was when I wanted to walk around the hallways of the hospital. And because my white blood cell count was so low, it became very important for me to make sure that I was taking every precaution I could to not be in contact with any germs or any kind of bacteria, because the white blood counts is what helps your immune system fight off disease. But because I had zero white blood cells because of the chemo, if I got a little bit of germs on me, we didn't know what it would do. So there was a lot of times where during that week I would get a bruise or I would get a little nick on my body, and we would have to do all kind of blood cultures and biopsies to make sure that it wasn't an infection or any new infections that was being caused by the cancer. So that was another thing that went on. My diet changed. I went from, the wife would bring me food, and, I would eat whatever food that I wanted at the hospital, which, at early stages, the hospital food wasn't bad. But when you stay there for months, I mean, it don't taste as good as it did when you first got there. But the diet changed to the point where I couldn't eat things like salads or, fresh fruits and vegetables, because I wasn't sure if whoever was serving the food or where we bought the food from, if they had cleaned it properly. So if they didn't clean it properly, it would cause an infection in my body. I couldn't eat a lot of fruits. The only fruits that I could eat would be things like oranges or bananas or something that I had to peel in order to get to. So it was for maybe the first 2 months I was there, I ate a lot of oranges, bananas, and then I had some of those cups, like the cup of pears and the cup of fruit, stuff like that. But I couldn't have almost anything fresh just because of the bacteria that would be possible on it. I had to reduce the amount of sugar that I had, and it just became very difficult to kind of keep eating when you was kind of limited to what you can eat. A lot of the stuff that the hospital provided, I didn't want to take that because I was on a regular diet, but it had some restrictions to it. But that, along with the transfusions, it's the fact that I wasn't eating the way that I was used to, so I wasn't probably taking as many calories, and that brings me back to not taking in as many calories as I was taking in normally. I slowly start seeing my weight decrease. When I got there, I was 190 pounds, and by that third or fourth day of chemo, I was down to 183. So it was slowly declining, along with my blood levels. But during all that, I just kept telling myself, I'm going to force myself to eat, I'm going to force myself to move, and I'm going to force myself to stay positive. Never did I think that, anything bad was going to happen. I always knew that I would get through it. I just have to deal with whatever the situation was. But the actual mutation that I got was a IDH1 mutation, which affects the metabolism or the maturity of my cells. And because my cells weren't maturing, it was basically it's like having kids that never grow up. And when you have too many kids running the asylum, chaos happens. And that's basically what was happening in my body. So the AML cancer, like most cancers, you have different stages. But AML doesn't work in stages. It's like a early, intermediate, and advanced phase. So when it's the early phase, you know, you don't have any symptoms. The only way that you would know you have it is if you have a blood test and it tests for that, or or bone marrow biopsy and it tests for that specifically. So I was diagnosed in the intermediate phase, which was good because in the intermediate phase, uh, the most common symptoms are high fever, which I had, and fatigue, which I had. Like I told you before, that week prior to, I started feeling tired just doing my daily task. And then there's the advanced type of AML, which you would have organ failure. We caught mine in the intermediate phase early enough so that we could get the chemotherapy started before it advanced to the advanced phase. So I was blessed with that. And this was probably the 31st of October, which was Halloween of last year. And this is when it finally hit me that, I'm going through something serious. 'Cause this was the first time, I think, in the 12 years since I've had my daughter, or we've had our daughter, that we didn't spend a holiday together. And this was the first holiday that I missed with my kids, and that's when it started, really sinking in that, like, my life is going to be different for a while. So I went through that emotionally. There was a lot of nights where I would, unable to sleep, I would talk to the nurses, and they would just, calm my heart, calm my mind with some of their stories, and it just became very hard to sleep. During the day, I didn't really worry about any of those things, because, you always had doctors and nurses and techs and, people coming inside your room. I was able to watch TV. My wife was there. My kids were there. I had friends and family that would visit. So you didn't have a lot. You had things that would distract your mind. But when the nighttime came, that's when you could start really thinking. So it became hard for me to go to sleep. And then when I did fall asleep, I would have to be waking up because I had to take vitals, or I had to take this medication, or I had to take that medication, or, whatever the case may have been. So I wouldn't get a lot of sleep. So what I did was I asked the nurse to give me some kind of medication that would help me sleep. So I tried melatonin, I tried Xanax, I tried a couple other drugs that would help me fall asleep. And what I did is I went to sleep in a position so that, my PICC lines was available, my fingers, my hands was available for them to take my temperature and my oxygen levels. I tried to make it as easy for them as possible so that whatever they needed to do, they can do without waking me, if that was possible. And that worked for a little while, but being on those medications for sleep, they caused me to have a lot of crazy dreams. I mean, dreams to the point where, like, I felt like I was walking with God, or, looking at my life from a different point of view. And there was one night where, I really thought that I had died, and I woke up and I wasn't sure if I was awake or if I was still dreaming. And that was very scary because, the dreams became so vivid that they felt like they were real. And I had to deal with that basically those first 2 weeks of the chemo. That first week where I was actually getting the chemo, the induction chemo, and then the symptoms for a week or so after that. So after I finished the chemotherapy, the first one was the 3 day, and then the 7 day. That's when a lot of the fatigue really started setting in. Like I said, like before, I would just be tired. I would push through it. There came a point where um, I was so tired and I was moving so little that the nurses were worried that there was something wrong with me because that week to 10 days prior, they had seen me 2, 3, 4, 5 times a day walking through the hallways for 30, 45 minutes. I was cheerful when they came into the room, and now, I wasn't even talking. I wasn't moving because I was just so physically drained. Um, it came to a point where they thought that it was me not getting enough nutrition. So I had to not report, but I had a dietitian come back to my room, and they started giving me basically meal replacement shakes and protein shakes in order to get the calories back into my body. Uh, and I mean that was good because I worked out a lot, so those shakes were pretty good. I was using those a lot. Sometimes I would just take them just because I wanted something to drink. I was drinking water like nobody's business. They gave us cups. I don't know if you've ever been in the hospital, but you get the little hospital cups that hold about, I want to say 32 to 48 ounces of water, and I was drinking 8 to 10 of those a day, along with apple juice, orange juice. Doing everything I can to make sure I stay hydrated because getting dehydrated would not be good for me because it causes fevers. And when then you have fevers, that means you get less sleep and you got other issues that you got to worry about. Like I said before, I was immunocompromised, meaning I didn't have any white blood cells. So a lot of bacteria would, I don't know if it actually happened, but we had to be cautious that something that we found on my body wasn't harmful. So a lot of the medications that I got, I went from medication A to a stronger medication B, and then from medication B to an even stronger medication C because we kept finding these different lesions on my body. Um, and I mean that was basically the first week getting the chemo and dealing with the fatigue and the lack of sleep and the night fevers. I mean that was very hard to deal with, but we got through it. I stayed positive, and what helped me was knowing that my wife was going to be there every morning. Every morning the doctor would make rounds, and by 7 o'clock in the morning, I want to say it was 7 o'clock, he would come to our room. So my wife would be there before 7 o'clock every morning, and she would stay with me until midday, late in the day, until it was time for her to go and pick up the kids from school. And she did that begrudgingly because she wanted to stay there with me. But the type of person I am, I knew that I can handle this because physically I felt good. I felt like I'm just tired. My muscles are just tired. It's not the first time I've been tired before. I'll get through it. But I wanted her to be there for our girls, and I didn't want her to spend her whole day with me. So she would come up there every morning, and she would stay until lunchtime or a couple hours after lunch, and then she would go get the girls. Sometimes she would come back at night with the girls, and we made it work. It was a rough couple of months, but we made it work. So I finished the chemo. The next steps would be to get another bone marrow biopsy to see how effective the chemotherapy was. And here's another thing that I want to point out. If you don't have good insurance, make sure you get good insurance. I talked to one of the doctors, and they were telling me that after the chemo, what happens is a lot of people get discharged and they do their after chemo care or post-op chemo care at home. Now, the problem that you have to deal with when you go home is that you're immunocompromised, so you don't have any way to fight any kind of infection. So being at the hospital would be your best bet because they're sterilizing the hospital, sterilizing the room. I had someone come and clean my room, clean the bathroom, change my sheets every single day. I would have someone wipe down all of my lesions and the sores that I had on my body. They would wipe down all of the catheter that I had in my arm. My wife would come and help me, wipe down my body because I had these tubes and I had the IVs, so I couldn't just take a shower. So I had to make sure that I stay clean. And I had the nurses who would make sure that all of that happened. And if you go home, you don't have that. And you have to worry about getting infected just from something as simple as touching the door handle or, walking into another room that has dust. Like, the hospital became my safest place. So I spent the next 2 months in the hospital recovering from the chemotherapy, along with getting all of the other drugs and other things that would happen during those 2 months, or not 2, but 4 weeks or so. One thing I do want to say is that how grateful I was for the nurses, because no matter what I was going through or what other patients on the floor were going through, and it sounded like they were having a far worse time than I was, the nurses stayed positive. They always smiled. They answered every question that I had, and when I needed someone to talk to, they were there for me to talk to. That was that first week of chemo. I went from being diagnosed on Sunday to getting chemo on Tuesday, doing 7 consecutive days of getting chemotherapy, 24 hours a day for 7 days, going through fatigue, going through physical pain, going through emotional pain. The hardest part for me was being in the hospital and not being able to be there for my girls and for my wife. I've been a stay-at-home dad since I retired in 2018, minus 1 year of working at the school as a PE teacher. But I was there for the girls, so I was helping them get their day started. I was getting them ready for school, taking them to school, picking them up, taking them to practice, running errands, cooking food, cooking dinner. I was doing everything that entitled for that day. And being at the hospital and not being able to do that, not being able to go to basketball games or go to volleyball matches or go to, school events, that stuff really played a huge role in like the emotional trauma that going through something like this causes. So I tried to stay positive. I tried to tell myself that it's only temporary, which it was, and we got through it. But like I said before, to start this video off, I relied on my faith a lot. I had friends who would call me every day and pray with me. I had friends who send me uplifting spiritual music to keep my mind and my heart full of joy. I can't thank those individuals enough. My friends that live around us, they would help out my wife whenever she needed it. They would help us do things around the house. They would help us with the kids, and so grateful for that. It was very eye-opening to see the support that you get when you go through something, and that was that first week. Very tough emotionally, more emotionally tough than physically tough, by far. So that was that first week of chemo. The next few weeks after that would be basically just recovering at the hospital. There was a few things that happened, as far as what was required. But I would basically stay in the hospital. I want to say is until Thanksgiving, recovering. So finished with my chemo. I want to say it was that first week in November, and I would stay until the end of November, just recovering before they discharged me to do some at-home care, which I'll talk about in the next video. That what that experience was like and what it required. But that was it. First week chemo out of the way. Now we just recovering.